Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. Now, yellow fever is a serious, potentially deadly flu-like disease spread by mosquitoes. The virus is endemic in tropical areas of Africa and Central and South America. The first yellow fever case in a current episode in Bauchi State was discovered in August this year. As at October 16th, there were 142 suspected cases in 10 local government areas. 24 cases were confirmed and there were 22 deaths. Now, we are grappling with yellow fever in 5 different states. The World Health Organization estimates that a strategic partnership to eliminate yellow fever will have about 1 billion people protected against it by 2026. My guest is an epidemiologist and a member of the National Technical Working Groups of Yellow and Lassa Fevers with the Nigeria Center for Disease Control, NCDC. Abiodun Oguniyi joins us from our Abuja studios. You're welcome to the show.
Thank you very much, Mary. Good morning.
Now, this disease is caused by a mosquito. What type of mosquito is so deadly? And do our regular insecticides affect it?
All right, thank you. There are many diseases that mosquitoes cause. Yellow fever is one of them. Now, there are different species of these mosquitoes that transmit different diseases. 10 of them have been highlighted as very, very dangerous. And we all know the popular ones, the malaria. Now we talk about yellow fever. Now, straight to the question about why, if the regular insecticide work. Of course, yes, it does. However, years back in the US, in one of the regions there, in their effort to eliminate, to eradicate yellow fever, they tried to use some insecticide at low dosage. With this, the resistance was built by these mosquitoes, and they came back in large number. They grew resistance to this. So it is possible also that we have incidents of resistance if we have low quality or low dose of insecticide used on these mosquitoes.
Okay, tell us, what are the symptoms of yellow fever?
It is not specific, like we will say. It mimics other symptoms of diseases that will possibly come on around us. For instance, it comes with fever, just like from the name. It comes with pains, muscle pains, back pains. It comes with headache. Now, there may be loss of appetite, there may be fatigue, there may be nausea, there may be vomiting. You agree with me that most of these things I mentioned are common with other diseases, even with malaria. And so it's difficult to say this is yellow fever in the initial phase of the disease. However, when the disease progresses, now most patients or most persons who get infected with the disease, within 3 to 4 days, they get better and they recover well. Now, after that, a percentage of them, like 15% of those who get infected initially, may progress to the advanced stage of the disease. And that is where organs are now involved. That is when it affects the liver, and you start seeing yellowness of the eyes. That is called jaundice. When this happens, other organs can be involved. The kidney can be involved. Then later on, the affected person starts bleeding. They could bleed from the mouth, they could bleed from the ears, and so on. So when it gets complicated, those can happen. And in that number of cases, death is highly increased. Unlike the first one that people can really recover. Could you take us through
an elimination process? Because patients may be confused. There's fever, there's headache, there's nausea, and that could be malaria. So could you take us through an elimination process of diseases? And can this elimination process take, say, 2 days or 3 days so that the yellow fever is caught at the beginning?
All right, thank you very much. The incubation period that's the time it takes between when somebody is exposed to the disease, to the infection, and when it starts showing signs and symptoms. For yellow fever, it's between 3 to 6 days. For malaria, for instance, the incubation period may be more than that. Now, individual varies based on how they respond to disease, based on their immune status. Now, what we advise as public health practitioners is that for every disease that we see around us, because most of the organisms causing this disease have been able to adapt over time, they mutate, they go through a lot of changes to ensure that they are also continually around to keep causing the danger. And so because of that, when they come with those initial symptoms, the best bet is for affected persons to avoid self-medication. No fever is common that you just say, like people will say, it's malaria, go and buy anti-malaria drug. No, because these are especially in endemic areas where these diseases have been reported. For instance, part of Africa, WHO put the statistics that more than 468 million people are currently at risk, with 33 countries in Africa at risk. Of course, also some countries affected in other parts of Africa, of the world, in South America, for instance. So when individuals are in those endemic areas where yellow fever has been reported, and I also put Nigeria statistics into it, that in Nigeria, for instance, almost all states in Nigeria have reported suspected cases. They've had some symptoms that are suspected. But in recent times, we've had it confirmed in a number of our states. So if people are in those areas where these cases have been confirmed, it is expected that when they have fever, they should present themselves for testing in a government laboratory, which has the capacity. So if anybody has fever, the best thing is to test.
When someone does present and has yellow fever, how do you treat? Because we hear that there's no medication for it.
All right. There is really no medication, just like for Ebola too. And a lot of other diseases like that. So, but for yellow fever, it is called supportive treatment. So when the patient presents with the disease, whatever symptoms being presented or being shown, being demonstrated by the patient will be managed based on that symptom. For instance, you have a headache, they give medication to handle headache. The patient is vomiting, they give medication to arrest vomiting, and on like that. So until the body system is able to gather the enough immunity again to start eliminating the pathogen from the system, and the body starts to recover, if you are losing fluid, they replace fluid and all that, so that the body is able to build enough immunity again to eliminate the organism from the system. And the beauty of it is that as soon as the patient recovered, it confers lifelong immunity, meaning it's not likely going to reinfect the same person.
Okay, so now there is a vaccine for yellow fever. At what point is the vaccine supposed to be given? Is it on the EPI for infants?
You are correct. So vaccine for yellow fever is given at 9 months for every child. Now, there is the gap between, for children, for instance, who are not able to have the vaccination at that period. And this is one of the reasons why a gap is created in elimination process for yellow fever when we have a large pool of people who are not immunized against the disease because they missed or they were not able to get vaccinated at that age of life. Now, periodically, there is meant to be immunization programs that provide what we call the preventive massive vaccination campaign, the mass vaccination campaign, wherein people are meant to be reached from place to place, especially areas where the burden of the disease have been identified, especially the at-risk group. Now, it's expected that these people are vaccinated from time to time. But because of a lot of other factors, challenges, financial challenges, and all that, the vaccines are not readily available for such process. We are only hoping, relying on the ones that are given routinely as part of the immunization schedule for infants. So if we have it given to the child at 9 months, it confers lifelong immunity on the child. So there's no need for booster dose. Now we have another opportunity for those who travel out of the country. If you are coming from an endemic country or at-risk country for yellow fever, you're expected to be vaccinated, and that is the issue of the yellow card that comes up before you arrive at the country of destination. You have to show that you have been vaccinated against yellow fever. So those are the two opportunities, the two windows available when there is reactive and when there is mass vaccination.
Okay, so
now, if there is an
let me quickly
outbreak
cut in
of
here.
disease,
One injection confers lifelong immunity. But we got reports that some people were refusing the vaccine. Why is that?
of course, attitudinal problems does not get resolved overnight. People have different reactions to information being given to them. There are also rumors here and there, and that is why at the Nigeria Center for Disease Control is one of our critical activities to have risk communication activities, engagement of the community when we have outbreaks like yellow fever or any of the outbreaks. There is a need to engage the community members to let them understand the importance. Now, people react when they don't, in the negative, when they don't have the right information. And if they don't have the right information, they could also feed on the wrong information around. And this may make them to take wrong decisions. So if they are guided, and that is why we always encourage people to find it convenient to log on to credible websites of the public health agencies of the country, for instance, like Nigeria Center for Disease Control website, where you can get correct, up-to-date information about diseases of interest before you take action. So for vaccination, if people are given the truth about it, there could be different lies flying around as to why they should not take it. But we engage them from time to time when you go to those communities to tell them the benefit this confers on them, and that they should understand that the mode of transmission of this virus, for instance, is such that everybody could be at risk as long as there is such mosquito that could transmit it around. Because when the mosquito picks the virus from one person, it transfers it to its own egg, and it will keep reproducing with that same virus on the generation of eggs of mosquitoes to be produced over years. And as long as the people move around, they pick the virus from one place, they pick mosquitoes from one place to the other, the virus can be transmitted to people. So we are all at risk. And it's until people are now affected and people are dying that we start hearing that, okay, there's a problem somewhere. But we need to all take action. People need the right information. They need to get to the right sources to get their information so that they stay protected and accept the vaccination because it is free, it does not cause any harm, and it's been around for more than 60 years that this vaccine has been discovered, and it's very safe to use. And that is what we encourage all Nigerians to assess as soon as they have the opportunity to do so.
Now, I believe that the NCDC is doing a lot of treatment of patients, everywhere that yellow fever has broken out. But we would like to know what other things are you doing and how are you engaging the people, the community? We want to know if the response is better now and people are getting more understanding or if you need more help. But we will come back after the break and get your answers. Welcome back. 0808-054-2233 is the number to call if you have any questions on yellow fever. You can also tweet at CTV_Mary A. And let's find out what's going on with the response to yellow fever all around the country. Now, you were about to tell us the extent of NCDC's engagement with the population, concerning this outbreak.
All right. The outbreak of yellow fever dated back, the current one dated back to September 2017 in Borno State. I was on the field then. I was deployed by the NCDC to lead a team to Borno State when it was declared as a case of acute jaundice syndrome among the population there. And that was where, upon testing, was discovered that it was yellow fever. Now, the Nigerian laboratory did the confirmation and was further sent outside the country to confirm same. Now, that dates back to 2017 when we have been at the Nigeria Center for Disease Control supporting, providing response in line with the mandate of the Nigeria Center for Disease Control to prevent, to detect, and respond to public health emergencies. In 2018, we had incidents of yellow fever in Kwara State, And even in this year, we have responded to a series of other instances like we had it in Ebonyi State. Now, in all of these, and with the recent one which happened in Bauchi State, in all of these, the Nigeria Center for Disease Control has a structure which is to
Mr. Oguni, let me
establish,
cut in there
initiate.
for a second. We'll continue. We're having a caller, Chooks. Hello, Chooks.
Yes.
What's your question, Chooks?
Doctor.
Good afternoon.
Yeah, my question is, once you've taken the vaccine for this yellow fever, do you need to repeat again?
Okay, thank you so much, Chooks, for that question.
Lifetime. Because
All
we've
right.
taken it before. I don't know whether that one is expired or we need to take another one again.
Thank you. So can you reiterate for us? We've taken one injection of one vaccine of yellow fever. Do you ever need to take another one in your lifetime?
So, like I said earlier on, once taken, it confers lifelong immunity. There is no need for booster dose. Now, we've said it, we repeat it, people should have the opportunity to get vaccinated. There is no need to go for more and more doses. It confers lifelong immunity. Unlike what was previously said or known that it was for 10 years, as advances in research are being conducted, it's been found that even those who got infected once, if they recover, it confers lifelong immunity on them. Ditto for the vaccine that is being deployed to people too. So having said that, back to what we were discussing about the role of Nigeria Center for Disease Control, we like to say that we have all through the year, technical working groups of experts cutting across multi-sector, multidisciplinary field, responding to all public health emergencies in the country that is within our purview. Yellow fever is one of them. And in that response, we have groups of professionals and experts from Ministry of Agriculture, from Ministry of Environment, and even from Vector Control. I remember we engaged the National Arbovirus and Vector Research Center in Enugu, even in all the previous yellow fever outbreak. All pool of experts who come together.
Let's quickly take Bright from Abuja. Sorry to cut you there. You will continue. Let's take Bright from Abuja. Hello, Bright.
Yeah, good afternoon.
Good afternoon, Bright. What's your question?
Yeah, please, in regards to the yellow fever stuff, I have a question to ask. If someone has been vaccinated of yellow fever, is there any need of being revaccinated again?
Thank you very much, Bright. This seems to be a big concern, and possibly we're getting new viewers as the minutes go by. So I would like you to reiterate about the vaccine, the yellow fever vaccine, please.
So thank you, Bright. I am reiterating, studies have confirmed it, research have shown it, that if you have been vaccinated once, there is no need for booster dose. There is no need to be revaccinated. You are protected, and it confers long life immunity. Now, let me put a caveat and say, in medicine, we say never say never. Maybe in the next 20 years, at least within the available knowledge and research, that is the position. Maybe in the next years, the virus may go through mutation and anything could happen, but that will determine what we'll do then. But for now, based on the information we have, the research and studies of years, it confers lifelong immunity. Having said that, in the interest of our time, at Nigeria Center for Disease Control, we're primarily focusing on creating awareness about the disease for the people across the country and even in the affected area. We have public-private engagement, for instance, with Facebook, where we reach out to Nigerians to let them understand the basic information, the preventive efforts they need to take in avoiding the disease. Because prevention,
can we take Doris now? Could you pause for a minute and let's take Doris. Hello, Doris. Are you there, Doris?
Hello.
Hello. What's your question?
Yes. I want to ask, what this sickness, does it have any age range? Is it for just children or adults?
Thank you very much. Thank you very much, Doris. Can this disease affect children as well as adults, or does it have an age restriction?
So from ages of vaccination, which is from 9 to
That's 9
possibly
months.
59, and even it's been reported, in upper border ages, anybody could be affected. The current one that we have in Bauchi State, almost 60% of the cases are those within 22 years and below. So why is because the young population are most affected, because these are the people that may likely go into the bushes, the people that may likely go have outdoor engagement, and the virus is being transmitted by mosquitoes that bite majorly during the day. And so those who have increased activities during the day may be exposed more than those who don't. So our aged persons, maybe those in the 70s and the 80s, who do less of outdoor activities, may not be as affected as the younger population who are outwardly mobile. And having said that, back to our question, the discussion about what NCDC is doing, we partner with the National Primary Healthcare Development Agency with the vaccination issues. So we support them on the field. We are the agency of government, is our sister agency in charge of vaccination. So we support them on the field. We work together on the field because we all know that while vaccination is very critical and is the most effective method of preventing the disease, in case of low coverage, when there is high population of susceptible people, one thing that is also critical is having good surveillance in place, wherein people can easily detect when there is signs and symptoms. So we engage our surveillance officers that we have across the country, disease surveillance officers in all the local government areas. We train them on how to detect the disease and how to report. We support the management of the disease by mobilizing the necessary resources and training.
So you have so many people on the field.
On index of suspicion.
Let's get Bayo from Ogun State. Hello, Bayo.
Hello.
What's your question? Welcome to the show.
I want to ask if we can take this immunization you are talking about, even when one is not affected with it.
Even when one is not.
The injection?
If I'm getting you right, you're saying, can someone take the vaccine when he's not affected with yellow fever?
Exactly.
All right, we'll answer that question. That's an interesting one. Over to you.
Okay, thank you. It is actually administered on those who are not affected yet. If somebody is already affected by the disease, then the next thing is to manage the symptoms with the supportive treatment for them to recover. For such persons, studies have shown that they have lifelong immunity. The infection the body would have been sensitized already based on the infection they have, and so they don't need vaccination again. Now, for others who are healthy, who are physically not having the disease, is encouraged that they should go for the vaccination. So back to what NCDC is doing. In line with the global strategy, we are supporting the states across the country to develop the capacity both for detection, for early reporting, for awareness creation. And in Nigeria Center for Disease Control, as of 2017, we were sending samples to Lagos, but now at the Nigeria Center for Disease, that's one of the hospitals in Lagos. But at Nigeria Center for Disease Control, we have almost 3 laboratories now that are able to test.
I'm sorry to cut you at this
yellow
point,
fever.
but we really must take the callers. Ikechukwu is calling with some contribution from Yola. Hello, Ikechukwu.
Hello, good afternoon.
Good afternoon. What's your question?
I want to know if I don't know if I've taken the vaccine. I'm over 40 years now. I can't remember if I've been vaccinated. Well, what do I do? Should I go for another one or what?
Thank you. Very valid. Could you take us through that?
Okay, so there is no contraindication. There is no challenge in doing that because not many people will remember if they have taken it before. Most likely you didn't have the records. So it is not out of place if you are not sure to take a dose. But after you have taken and you are sure you have your record, please, you don't need another one to take.
Okay,
So
thank you very
I
much,
think that is clear
Mr.
for
Buni. I know you have a ton of things to say, all very important, but we've run out of time. Thank you so much for being on the show with us, and thank you, all of you at home, for contributing to the show. Just stay safe. You don't have to die from yellow fever. Thank you very much. I am Mary Alale Yusuf.